All right, buckle up, everybody, because today we're diving into the world of medical education
Oh, yeah.
in India.
This is a fun one.
It is a fun one. Specifically, we're looking at those non-clinical departments like anatomy, pharmacology, physiology, and all those courses that you have to take
Yeah.
to become a doctor.
Right.
Now, you might think, well, who teaches them?
Yeah, who are these people?
Well, turns out in India, it's a very...
Oh, it's a hot topic.
It's a hot topic. It's a big debate right now about,
Qualifications.
Qualifications. And who should even be leading these departments.
That's right.
So the big question is, should it be folks with those traditional MBBS and MD degrees?
Right.
Or should it be those with a medical MSCs?
Uh-huh.
And you would think, well, a medical MCs, isn't that, good enough?
You would think so, but not necessarily according to some
pushback.
Big pushback, yeah.
So we're going to unpack all of that today.
Looking at this source material, it really digs deep into this debate.
It does.
And the tension surrounding recognizing those with the medical MSc.
And they've been like a vital part of the education system for a long time.
For years.
Yeah, absolutely.
Both of these types of educators are very important in training doctors.
So kind of set the scene for us. What's the situation right now in India in terms of like who's making the decisions?
So who's calling the shots?
Yeah.
Ultimately, it's the National Medical Commission, or the NMC.
Okay.
They have the final say with the Ministry of Health overseeing things.
Okay, so they're at the top. They're kind of like the big...
Setting the standards, yeah.
Setting the standards.
And there is this historical tension.
Yeah.
It's coming to a head right now.
Okay.
Because MBBS graduates, they're not exactly lining up to teach in these departments.
Yeah, you assumed if you went through all that training...
You'd want to go into practice.
Yeah, you'd want to be a doctor.
Right, yeah. A lot of MBBS grads see the lack of clinical practice in these roles as a drawback.
Right, because they want to be treating patients.
Exactly. They want to be in the hospitals, in the clinics.
Yeah, working with people.
Absolutely. So then what happens? Are these departments just like, well, I guess we don't have any teachers?
Well, that's where those with the medical MCs really shine.
They step up.
They're vital in filling these gaps.
Okay.
It's not like they're not trying to attract the MBBS graduates.
Right.
They've even lowered minimum scores.
Really?
For the entrance exams, and still so many positions are vacant.
Wow.
So these medical MSCs, folks, they're super important.
Yeah.
And it's interesting because the term non-medical to describe them is a real sticking point.
That's so weird because, like, it's a medical MSc.
Right, it's a postgraduate degree.
You get it out of medical school, right?
It's earned under the Faculty of Medicine.
So how is that non-medical?
Exactly, it's a total misnomer.
Yeah.
And this really feeds into this feeling of being undervalued. Right, because if you keep hearing that, you're like, well, what am I doing now?
What am I doing? Yeah, am I not good enough?
Right, am I not a part of this?
Exactly.
So I guess that leads to this big debate.
Yeah, it's really about leadership.
Okay.
Should those with a medical MSCs be eligible to head these departments?
Like as the head honcho?
As the head of department, the HOD.
The HOD.
And traditionally, it's the senior-most professor.
Okay.
Often someone with an MBBS MD who'd take that role.
So it was just kind of an unspoken rule.
Yeah, you move up the ranks, you become the HOD.
You put in your time.
Exactly.
Oh, okay.
But more and more medical MSc holders are rising through the ranks. They're like, well, wait a minute.
What about us?
Yeah, why not me?
We've been here just as long.
Exactly.
We've put in the work.
And this is where it gets a little
spicy.
The source material even uses the term academic apartheid.
Wow.
To describe the situation.
That's intense.
It is.
Okay, so it's like a systemic bias.
Right, like a deeply ingrained bias within the medical community.
Yeah.
That they're being excluded.
Okay.
And not just excluded from the position.
Right.
But almost like looked down upon.
Less than a heart.
Yes, yeah.
So is it just that they're anti-MKs?
I don't know if it's that simple.
Or is there something more to it?
It's complicated.
Yeah.
But the source material does point out, like...
What does it say?
The NMC, the regulatory body, maybe they shouldn't even be dictating who becomes HOD.
Like, let the schools decide.
Yeah, let the institutions have some autonomy.
Okay.
To choose who they think is best suited.
Regardless of their exact degree.
Exactly.
Okay, but I can see the other side of that, too, where it's like, well, if you're running a medical department...
Don't you need a doctor?
Don't you need to have been a doctor?
Yeah, it's a valid concern.
Yeah.
And some people feel like only a doctor can truly understand the needs of a medical department.
Right.
And lead it effectively.
So what do they say about that in the article?
Well, they bring up some good counter-arguments.
Okay.
For example, they talk about how the odd role is primarily administrative.
Okay.
It's not about providing direct patient care.
Okay.
It's more about managing the department, making sure things run smoothly.
Okay, so less about, like, knowing the specifics of how to...
Right, not about diagnosing patients,
Right.
but more about, like, keeping the department functioning.
Yes, scheduling classes.
Yeah, exactly. Managing budgets, all that stuff.
And so they're saying that a medical MC...
Especially someone who's been a professor for years.
Right.
Would have plenty of experience to handle that.
Okay.
They've seen it all.
So they're saying it's not really about...
The specific degree,
Yeah.
it's about the experience and the skills
Okay.
that you bring to the table.
All right. So it sounds like there's,
Valid points on both sides.
valid points on both sides.
Yeah, it's not a simple black and white issue.
So I'm assuming we're going to, like, really get into the nitty-gritty
Oh, yeah, we're just getting started.
in the next part.
We're going to look at some specific cases.
Oh, cool.
Legal battles.
Oh, lawsuits.
Yeah, this debate has gone to the courts.
Oh, wow.
So we'll dive into that next.
I can't wait. This is juicy.
Oh, it's good.
This is really good.
Stay tuned.
All right. We'll be right back after the break.
Welcome back, folks. So last time we were starting to get into the legal side of this whole debate.
Right. It's not just theoretical anymore.
No, it's gotten real.
People are lawyering up.
People are taking it to court.
Yeah, and that term they use, academic apartheid, that's pretty strong.
It is, and it really highlights how strongly some people feel about this.
Like they're being shut out.
Yeah, and almost like looked down upon.
Like they're not good enough.
Right.
Just because they don't have those specific letters after their name.
Exactly.
But I'm still trying to wrap my head around what the other side is so worried about.
Yeah, it's a good question.
Like, is it really just about qualifications?
Well, the source material digs into that, and there seem to be a couple of main anxieties driving this resistance.
Okay, what are they?
One is this idea that only doctors truly have the authority and knowledge to run a medical department.
Like they've been there, done that, got the stethoscope.
Exactly.
So they know what it takes.
Right, and they're worried that someone without that clinical experience might not make the best decisions.
About what?
Well, everything. The curriculum, research directions, even the budget.
Oh, I see. Like they're worried someone without that practical experience might make decisions that are too theoretical.
Exactly, like they're not grounded in the reality of what it means to be a doctor.
And then there's the whole reputation thing, right?
Oh yeah, that comes up too.
Like they're worried about how it looks.
Right, there's this concern that having a non-doctor in charge could make the whole medical education system seem less rigorous.
Less prestigious?
Yeah, and that could even impact how people view doctors in general.
It's like they're trying to protect the brand of being a doctor. But I keep coming back to this. If the Hodge job is mostly administrative, does it really matter if they've been a practicing physician?
Well, the source material argue that it doesn't.
Okay, how so?
They really emphasize the managerial aspects of the role.
Like what?
Making sure the department runs smoothly, managing faculty, overseeing budgets, all that stuff.
Okay, so less about medical expertise and more about leadership and management skills.
Right, and they point out that a lot of medical M.Sc holders have been doing this for decades.
So they've got the experience.
Oh yeah, they've caught countless students, conducted research. They know the ins and outs of their departments.
It's not like they just showed up yesterday.
Exactly.
They've put in the time.
And actually, the source material mentions that it usually takes a medical M.Sc holder about 9 years to reach the professor level.
9 years?
Yep, assuming they get promotions on schedule.
That's longer than some medical residencies.
It is. So by the time they get to that point, they've really proven themselves.
They know what they're doing.
Yeah.
So if we're looking at experience and qualifications, it sounds like there's a strong case to be made that a medical M.Sc holder could be just as capable as someone with an MBBS or ND.
Right. And the source material goes even further, saying that denying qualified individuals based just on their degree is actually hurting medical education in India.
How so?
Well, if you're only considering a small pool of potential leaders, you're missing out on all sorts of talent and innovation.
It's like putting all your eggs in one basket.
Exactly, and you're not getting the benefit of different perspectives and ideas.
I mean, it's got to be good to have people from different backgrounds in leadership roles, right?
Absolutely. It brings fresh ideas, challenges the status quo, and ultimately leads to better outcomes.
But I'm sure some people would say, hold on, there are going to be differences in how a medical MSc holder sees things compared to an MBBS or MD holder.
Oh, definitely.
Like their training is different.
Right. And the source material doesn't shy away from that.
Okay, so how do they address it?
They acknowledge that different backgrounds bring different strengths to the table, but they emphasize that a truly effective HO is a collaborator.
Someone who listens to everyone?
Exactly. Someone who values different viewpoints and makes decisions based on what's best for the whole department.
So it's less about dictating from on high and more about creating an environment where everyone feels heard.
Precisely. And they actually suggest that a medical MSc holder, because of their different academic path, might bring unique insights that a doctor wouldn't necessarily have.
It's like that saying, if you always do what you've always done, you'll always get what you've always gotten.
Exactly. Sometimes a fresh perspective is exactly what's needed to shake things up.
Okay, so we've talked about the arguments, but you mentioned earlier that this has actually gone to court.
Yeah, it's gotten pretty serious.
So fill us in. What's the latest on the legal front?
Well, the source material highlights a big decision from the Punjab and Haryana High Court.
Okay, what happened?
They actually struck down the NMC guideline that specifically barred medical M.Sc holders from being HODs.
Wow, that's a huge win for the M.Sc folks.
It is, but it's not the end of the story.
So it's not over yet.
Not quite. The source material says that everyone is really waiting for a ruling from the Supreme Court of India.
Like the final word?
Yeah, until that happens, there's still a lot of uncertainty.
So the legal battle continues.
It does, and the outcome of that Supreme Court case could have massive implications for medical education all over India.
This is getting more and more interesting by the minute.
It is, and as we wrap up this part of our deep dive, I think it's important to remember that this isn't just about degrees and titles.
Right, it's about real people.
Exactly, and in the next part, we're going to hear some of their stories.
Oh, I'm looking forward to that.
Because this debate is impacting their lives in very real ways.
This is going to be good. Stay tuned, everybody. We're back and ready to wrap up our deep dive into medical education in India.
You know, as we've gone through all this, it's really the human side of it that gets to me.
Right, because these aren't just abstract arguments. These are people's lives and careers.
And passions,
Right.
And reading through the source material, you really hear the voices of those medical M.Sc holders.
What are they saying?
There's a lot of frustration.
Makes sense.
Even anger.
Yeah.
At how they're viewed, how they're treated.
Within the systems.
Yes, within the medical community.
Because they're not seen as
equal. Not as valuable.
Well, they are valuable.
They are. And it's not just about, getting a promotion.
Right.
It's about respect.
It's about feeling like you belong.
Exactly. Feeling like your work matters.
And I can see how that would be really demoralizing.
It is. And there's this one quote from the source material that really hit me.
Oh, yeah. What was it?
It talks about how doctors are often put on a pedestal.
By society.
By society, yeah. And how some doctors
internalize that.
They start to believe it.
That they're better
than anyone without an MBBS or an MD.
Even if someone has just as much experience.
Even more sometimes.
But it's like those letters after your name.
They become this symbol of superiority.
A status symbol.
And so you get this resistance to anyone who hasn't followed that exact path.
Even if that person could be a great leader.
Exactly. And the source material calls this out.
What do they say?
They call it pride and prejudice.
Oh, wow.
And they argue that this kind of thinking is actually holding the medical profession back.
It's limiting.
It is, because when you only value people with certain degrees...
You miss out on so much talent.
On fresh perspectives, new ideas.
Diversity of thought, like we talked about before.
Exactly. And that's so important for any field, but especially medicine.
Because medicine is always evolving.
Always changing. New discoveries, new treatments.
And you need people who can think outside the box.
Who can challenge the status quo.
And who can bring something new to the table.
And that's what these medical M.Sc holders do.
They're a vital part of the system.
They're the ones teaching the future doctors.
Yeah.
Training them, mentoring them.
So this debate, it's not just about who gets to be the boss.
It's about the future of healthcare in India.
Because if you're discouraging talented people from pursuing careers in medical education...
Just because of their degree.
Then everyone loses out.
Patients, students, the whole system.
It's like shooting yourself in the foot.
Exactly. And the source material really makes a strong case for change.
So what are they proposing?
They're calling for a real shift in mindset.
Okay.
Away from this focus on titles and degrees.
And more towards?
Recognizing competence.
Okay.
Vision, leadership skills.
Regardless of background?
Exactly, because at the end of the day, it's about finding the best people to lead.
The best people to educate the next generation of doctors.
And to advance the field of medicine.
And that's something we should all be striving for.
Absolutely. A system that's inclusive, equitable, and innovative.
And that recognizes the contributions of everyone.
Regardless of their background or their degree.
This deep dive has been fascinating.
It has. It's really made me think.
Me too. And it's clear that this debate is far from over.
It's ongoing.
But hopefully, by having these conversations,
by bringing these issues to light,
we can start to move towards a more inclusive future.
For medical education in India and beyond.
Thanks for joining us on this deep dive, everyone.
It's been a pleasure exploring this with you.
And we hope you'll continue to think about these issues.
And how we can all contribute to a more equitable and innovative future.
For healthcare and beyond.
Until next time, keep those brains buzzing.
Bye, everyone.